But I do want to welcome you all to Session B, How to Communicate as a Caregiver. And before I introduce our speaker, I do want to acknowledge that today's breakout session would not have been possible without one of our session sponsors, Doug and Chris Ayahara. So if you can please just give me a round of applause as we kind of thank them for their support today. But even though Chris and Doug made this possible, we couldn't be here without our speaker, Carol. So I do want to introduce Carol Hahn. Carol is the community educator at Opeka Adult Day Program and Counseling Center here in Los Angeles. She is a registered nurse with over 35 years of varied healthcare experience, and she has taught several university nursing programs and worked in the Alzheimer's Association. Carol now conducts education programs on dementia and other geriatric topics in a variety of settings, both locally, nationally, in person, and now virtual. She has earned her certificate in the Alzheimer's disease management from Southern Indiana University and is a certified dementia practitioner through the National Council of Certified Dementia Practitioners, and is a member of the American Holistic Nurses Association. So Carol is well qualified as a speaker here today, and we are very fortunate to have her. So please join me in welcoming Carol Hahn.
All right, good to see everybody here. Are your heads full yet with all the information? All right, well, hopefully your stomachs aren't growling too loud. We'll get through this and then we can have lunch, okay? So I'm Carol Hahn. I'm the community educator at Opeka, which is an adult day center. We help people that have memory loss and dementia and their families, okay? And today I'm here, we're gonna talk about communicating with your care recipients' healthcare team, okay? Because you as caregivers have a really important role in helping support your care recipient and getting the care that they need from their team. So our objectives for today are, after you attend this session, you're going to be able to define communication. You're going to discuss the difference between verbal and nonverbal communication. You describe 3 techniques to use when communicating with your care receiver's healthcare team, and then you're going to practice your communication skills. So we're going to first start off by defining communication. And if we look at Merriam-Webster's definition, it says that it's a process by which information is exchanged between individuals through a common system of symbols, signs, or behaviors. So we know that effective communication isn't just blurting the words out. There's so much more that goes on. Think about your communication not only as we go through this presentation, but then think about it later today, in the next couple of days, okay? Because awareness is really good, and to really see how you're communicating. This will help not only with your care receiver's healthcare team, but it pretty much helps with everybody that you communicate with. So communication is more than just sending a message. Well, we're going to break it down now and take a look at some of the different components of communication. And these kind of all go together. They happen real quickly. You can see on the little diagram behind me, but they tend to interact with each other, but we're going to look at them separately here. So first you see over on the left is the sender. And that's where the communication process starts. The sender has information and they want to get it across to others. So for that sender to get the information across, they have to do what's called encode that information. So for example, here today, we're all speaking the same language. I'm encoding that into English so that you can understand me, right? If I were here talking another language that you didn't understand, then communication wouldn't happen. Next, we have the message. And the message is the meaning that me, the sender, is giving to the receiver or to you guys as the audience. So when I put together this presentation, it wasn't just the words, it's also the grammar, the organization, my body language. We're going to talk about that in just a minute, okay? But it's the way that the words, the way that the message is conveyed. We can convey messages, we can communicate on the phone, email, through a presentation like this, so many different ways. And then there's the receiver, the person that gets the information. Okay, as a receiver, you have to be able to decode that information. So again, we're both speaking the same language, so you're saying to yourself, oh, Carol's speaking English, I understand that, okay? Now, if you were here and you didn't bring your hearing aids and you can't hear me, all right, then maybe you're not decoding that message the same way, or you're only hearing part of the words I'm saying, that kind of thing. And then you guys are giving me feedback. The receiver gives the sender feedback. As I'm looking out here, do I see people sleeping? Or, see, I'm watching. Or do I see people on the edge of their chair so excited, taking in every word, right? You guys are giving that feedback to me. So I know, do I need to explain things a little bit more? Did you not get it? Or I see people are following me. And then we see at the bottom, we have what they call noise. And I often refer to this also as the environment, like what's going on around us, all right? So that maybe the chairs you're sitting in are real uncomfortable, maybe the room's too cold so you have a hard time paying attention to me, or there's some loud noise coming from the back. Well, those are all things that impact communication. We also see that if I want to talk to somebody, let's say I want to talk to my doctor about something, I'm probably, and especially if it's personal, I'm going to want to be somewhere like in an enclosed room with a door. I don't want to be out in the waiting room in front of everybody. So we're really thinking about how that impacts communication also. All right, so we talked about communication. Now let's think about the types of communication. So we have verbal, all right? So I'm speaking, you're listening. We also have what we call nonverbal communication. So what I want you to do right now is I want you to find somebody in the room. Maybe you get up and move, all right? And I want you to practice your nonverbal communication. So you're going to find a person, and you're going to take turns. You're going to communicate something to another person without using any words. And we're only communicating good things, okay? No, I know we can communicate nonverbal bad things, all right? So it's hard because people have masks on. Like one of the biggest nonverbal is a smile, right? But just turn to somebody and give them some nonverbal communication. I hear laughing. That's nonverbal, isn't it? Oh. Okay, I saw some bows. I saw some eyebrows raised. I saw some hungry symbols. Okay, right? Okay. Anything else? Any other good ones that people got? Thumbs up. Okay, great. See how much we can communicate without saying a word, right? So that nonverbal communication is so important also. And when we look at nonverbal communication, we're talking about all the different things that besides the spoken word. So if I come in here and say, I am so happy to be here, or if I come in and say, I'm so happy to be here, all right? Which way are you going to believe is the most positive? The first way, right? I said the exact same words, didn't I? But that tone, the tone of my voice, my body language, my expressions, all those things made such a big difference. So a lot of times we don't think about body language. And it happens, and we wonder why somebody got a different message than what we were saying, okay? So I love this chart because look at that pie there. 38% of our message comes from our voice, the tone of the voice, the modulation, all right? 58%, I'm having trouble reading now, 55% comes from our body movements. What are we doing with our arms? What's our face doing? Our eyebrows? All those good things, okay? And only 7% comes from the spoken word. So that nonverbal communication is so important. So really think about that. So again, take some time, as you're going, talking to somebody at lunch or tomorrow when you're out with some friends or whatever, really think about what you're showing with your nonverbal communication. We also have to be careful because sometimes different cultures have different types of nonverbal communication also. So just don't assume something of the other person. You may want to ask them just to make sure. So some cultures don't make as much eye contact. So if somebody's not making eye contact with you, you can just say that. I notice when we're talking that you don't make eye contact with me. Is everything okay? Give that person the chance to say, I'm sorry, I thought, in my culture that means disrespect if I'm looking in somebody's eyes, okay? So let them explain themselves instead of you just saying, they never make eye contact with you, they weren't interested, all right? Really think about that. So when we look at communication and we start to think about good communication, we want to be able to express ourselves clearly so that others know what we think or what we need. So that prevents misunderstandings. We also want to use communication to build and maintain relationships, not only with our care receiver and our healthcare practitioners, but with family, friends. When we use good communication, it also leaves us feeling better, and it makes others more likely to listen to us. And it reduces the frustration and the stress that comes from unclear messages. So when we communicate effectively, we have less frustration and we have more problem solving that goes on. So some of the skills we can use when we communicate are to think before we speak. So really take time to consider what you're going to say. A lot of times that may mean that you want to take some time, write something down, practice it, okay? Practice in front of the mirror. I practice with my cat. I was telling the last group that my cat's really good at giving me good eye contact and a little purring feedback, and okay? So, but then you'll feel more comfortable, especially if it's kind of an emotionally charged subject that you want to bring up. Take a deep breath. Really spend a minute and get yourself calm before you talk. We just talked about body language, so pay attention to the tone of your voice, to your body language. And then, whoop, I went one too many there. I'm back. There we go. And then listen, all right? Pay attention to what the other person's saying. So much of the time, we're so busy at thinking about what we're going to say. Somebody else is talking, and we're already deciding what we're going to say back to them, instead of completely listening to what they say. And you want to be assertive and honest. Make sure that you're heard. And then, like I said, I can't stress that one enough to be able to practice it. So we're going to practice right now. And what I want you to do, again, is to find somebody in the room. So you may want to get up. This is good stretching, moving around. When we move, it's good for our brain and our body. But I want you to find somebody else And one person is going to talk about anything they want to. It can be caregiving if they want. It can be your trip to Florida last year. It can be what your new little grandbaby did, what little cute thing your grandbaby did, okay? But one person's going to talk for a minute, and the other person's going to listen. And then the person that listened is just going to summarize back what you heard. All right? Oh, you just told me that your cute little 2-month-old grandbaby learned how to smile and coo this morning, or something like that. All right? And then switch so the other person gets to talk. So go ahead, find somebody in the room. It can be the person next to you, or if you came with somebody and you're tired of them, find a new person. Okay? Okay, if the second person hasn't had a chance to talk, it's time for them to talk. So give that second person a chance. Okay, start to wrap it up. It's hard to listen, isn't it? You want to jump in there, you want to say something. It's hard to stop talking too, isn't it? All right, come on back. I don't know how to whistle. I got to learn how to whistle. Yep. All right, let's go on. Or I'm going to have to flick the lights. Maybe that one won't work. All right, so as a caregiver, you really communicate with a lot of people. So you can see on the slides here, many people that you're communicating with. So you might be connecting with friends, with family, right, with your care recipient themselves, you may still be working, all kinds of things. Also, your care recipient may not be the person they used to be. You may be picking up some of the slack and doing things that they did, so that's real difficult. So it gives, it's a lot more responsibility on you, and that's really tough. I said to the other group, how many of you decided when you were a little kid, like, ooh, I want to be a caregiver when I grow up, right? We didn't think about that, all right? Okay, so when you're communicating, you really have to be an advocate for your care recipient, and that really helps them get the care that they need. So when you're communicating with the healthcare team, there's a lot of different people on the team, maybe physical therapists, maybe nurse practitioner, doctor, pharmacist, all those different people. But you as a caregiver are really a real important part of the team because you bring a lot of information to the healthcare practitioners, and that you may be the one that helps keep things rolling and keep things on track. Now, the healthcare team members may be very busy, but it's important that you get your questions and your concerns taken care of. And when you communicate effectively, that really helps you get the best care for your care recipient. So you really have to find a healthcare team that you're comfortable with. You know, do you like that team? Can you get the answers that you need? Are they supporting you? Right? If you don't feel your needs are met, maybe it's time to change. You don't have to stay with that same care provider, all right? Because the important thing is that, you know, you're the one getting these things done. And I think what's real helpful also, if possible, to appoint one family member as the main contact for the healthcare team. Because otherwise, if the healthcare team communicates with different people, then sometimes things get lost. So there may be one family caregiver that's the primary contact with the healthcare team, and then they may distribute that information to family or friends. It doesn't mean they have to talk to everybody, right? I know when my mom was just in the hospital a couple months ago, and so I was the one that did most of the healthcare stuff with her, and I had like a little text group that I would send information through. Or maybe it's another family member that's going to be the one. You give them the information and they call everybody, or they start a little Facebook page only with family members on it. Whatever works, okay? But it keeps it, remember that old game telephone when you talk down the line and then the message got all messed up and everything? That's what happens when too many people get involved, I think. So when you're caring for a healthcare visit, you want to make sure that you educate yourself about your care recipient's condition. And that's so important to learn as much information about what's going on with them as possible. Maybe you look at websites, maybe you go to a specific organization about that disease. You know, there's the American Diabetes Association, the Parkinson's Foundation, all kinds of different things. You have some booths out here that you can look at after lunch and stuff. So finding that information is so important then, all right? Because, you know, you want to put together a plan. What are you going to do during that visit? Because so many times, how many times do you leave the office and you're like, oh, I forgot to ask about that. So this is where you should be keeping records of your healthcare recipients' information, right? What are they eating? How are they sleeping? I mean, it doesn't have to be a complete detailed version, but you know, if you're tracking something, their weight, their blood sugar, their blood pressure, those kinds of things, it's so helpful if it's written down and you just bring that with you. Rather than, you know, you go to a visit and then you say, well, you know, I think their blood pressure was, I think it was 170, or maybe there was 70 was at the bottom, right? It gets confusing, but if you have it written down and you can look at it, and then it takes a lot of stress off you. You don't have to remember those things. You also want to think about what else we need to do as far as focusing on healthcare also. Maybe you need to start a list of questions or concerns and then prioritize them, right? What is the most important? If you've got 20 questions, your physician might not be able to answer all those. So let's start with the ones that you feel are the most important. Are there some that can wait till another visit or somebody else can answer for you? So I make a list, and then I make 2 copies of that list. I give 1 copy to the front desk because sometimes the people at the front desk can start things going. There may be something they can help with that you don't even need the other healthcare practitioner to work on. And then I give a copy to the healthcare practitioner. I keep a copy and I take my notes on that, okay? Because sometimes, it may be paperwork or you may need a referral to something else that people at the front desk can already start doing that. So when you're finished with your visit, they've taken care of that. You also want to make sure you bring ID, insurance information, all that kind of stuff. And then also bring names and contact information of other healthcare practitioners you've seen. And that's so important not only for your loved one, but also for yourself. You should have, like in your wallet or on your phone, a list of everybody you've seen in case you're ever in some kind of situation where you need to have that information. Also, you can see on this slide, it's a little list that you can use to start with. And this comes from a free pamphlet that's called A Guide for Older Adults Talking with Your Doctor. This comes from the National Institute of Health. And we've got some copies out at the Opeka booth. And if there aren't enough copies, you can order it online. You can look. I'll make sure I keep my copy so that you can take a look and order it through. They're free of charge. Or you can download a PDF on that also. And then when you're also preparing for a healthcare visit, you want to list all medications, because sometimes different health practitioners have given somebody different medications, and not all the health practitioners know about it. So I'm talking about all prescription medications, over-the-counter medications, vitamins, minerals, supplements, all those good things, all right? People tell me, well, it's an herbal one, it's natural. And I tell them, well, hemlock is natural too, all right? A lot of good that does is a lot of the medicines we have originally came from plants, and they have side effects to them. So we want to be careful. We want to make sure that they don't interact or causing some difficulty. So again, in this book, there's a little chart that you can list of your medications, but you just want to keep track of who ordered it, what's the dosage, what's the name of the medication, and there's all kinds of little forms that you can use for that. I have them on my phone, all right, and so and some notes on my phone, so it's always with me. And I told the last group, my husband was in an accident about 10 years ago. He takes 2 medications. And, I'm a nurse. I know all those medications. For the life of me, I was so stressed, I could not remember what he took. All right? So no matter how much you think like, oh, it's easy, I know that, when you're in a stressful situation, it gets really hard. So when you're communicating with your healthcare professionals in the office, we want to start by thinking about, again, organizing, because research has really shown us that caregivers have less stress and less depression when they communicate better with their healthcare practitioners. So I think the big thing here is to explain your role, right? What are you doing? What are you doing with this person, right? The doctor's supposed to be seeing this person, and now all of a sudden somebody else is there with them. Explain your role of what's going on, all right? Also think about your role is that you may not be able to make certain health decisions for your loved ones without the necessary paperwork. So thinking about advanced healthcare directives, okay? Those are important things. You want to ask questions about your health recipient's care. Maybe you bring a family member or a friend along with you. And because sometimes you may be busy taking care of your care recipient during the visit, or you may just be overwhelmed with everything you're hearing that one other person may be real helpful. All right, but be careful of who you bring with you. Make sure you tell them what they're there for, and that it's not somebody that you're going to start a big fight in the middle of, the doctor's office or anything. All right, somebody you got to get along with and knows that they'll ask the right things for you. If your practitioner allows it, maybe they'll record the visit, okay? You can record the visit on your phone, and then you can play it for family members. I know a lot of practitioners that'll do that, but make sure you ask up front. Just don't start recording it. Let them know that you're doing that. And when your care recipients in the visit also, make sure they can hear and see. My big pet peeve is when people's glasses are all smeary, so glasses nice and clean, hearing aids working, all those kinds of things that, your care recipient's gone to the bathroom and they're not hungry, all that kind of stuff. Request an interpreter if you need one. If you need an interpreter, let the front desk know that when you first get in the office. Don't wait till you're in with the doctor and then say, I really don't understand this language that well. I need an interpreter. All right, start that early. And then, get the practitioner to write things down for you. My husband came home from a visit and I said, well, so what did the doctor say? And he said, I don't know, it was some big long word and it had a P in the beginning, I said, well, let's get the medical dictionary out. Well, look, no, but so now I make him write everything down. I'm like, don't come home unless it's written down, all right? So that, and maybe I should start going to the doctor with him because again, sometimes it does get overwhelming, doesn't it? When they're saying things, especially if you don't understand it or you're confused on that. Ask about other resources. Sometimes they'll be able to give you pamphlets or brochures or whatever that's in the doctor's office. And many insurances or healthcare providers now have a portal that you can use, and you can download information after your visit. Anybody been downloading stuff from their portal after visits? Okay, I see a few hands up. And a lot of times that'll put in there like the diagnosis, any vital signs or medications and all that kind of stuff. So that's a nice way not only to get a review of what happened, but also to give to family members if you want to share information. Okay, and then you don't have to try and remember everything. So if you don't know how to use the portal, that's the time. Find somebody that's computer savvy that can show you how to do it, or assign a family member. A lot of times, I know Shannon was talking about earlier that people offer to do something. Let me know what I can do, right? I tell caregivers, make a list of possible things you need to have somebody do for you. And when somebody says, oh, just let me know what you need, say, well, here, take a look at my list, all right? Pick out the one that works for you, right? So those kids are so good at all the computer stuff. Maybe that's something for your, 15-year-old granddaughter to work on or something for you then. And then, like I said, feel free to change practitioners if you want to. You're not stuck with that person. That, it may take some time and you may have to do a little research and stuff, but you want to be treated like you want to be treated, and you want to get the answers that you feel like you need to. So when we communicate with our healthcare practitioners otherwise, like outside of the office, I think with COVID, it opened up a lot of different doors for us. So, before we always just went to the office for our visit. And now we can do more things on the phone. We can do it through telehealth or text. But again, we have to have the resources, the equipment, and everything to do that. So if you don't have that or don't know how to use it, get somebody to help you or stay with the visits, the actual office visits. But again, these are important things to remember, is that, first of all, be real sensitive about information you're sending, because things aren't always real secure if you send it through email and stuff. So you don't want to be sending, Medicare card numbers or, important Social Security numbers, those types of things, or different medical information that you don't want other people to do. And when we do things more online, we don't have that nonverbal feedback like we just talked about with, our our little pie chart there where we're showing we have more just the actual spoken word or written word rather than all the nonverbal stuff also. So when you're speaking, make sure that everything gets understood. So you want to be clear and specific, and that means you speak directly. You don't hint, you don't beat around the bush, hope the other person gets the message, right? Tell them what you need. If there's a problem, like let's say the nurse practitioner was really late in their appointments, tell the nurse practitioner, all right? You might tell the front desk too, but mainly talk to the person that you're having the issue with. So you also want to do I statements, and I statements are ones that tell about how you feel. I feel angry, all right? Rather than, what if I say, you make me angry? How does that make you feel? It's kind of like conflict then, isn't it? Right? Like you're confronted, and all of a sudden then you get mad back at me. If I say, I feel angry, all right, you're more likely to listen to me than me saying, you made me angry. Then you're probably going to shut down. So we want to try those I statements. We want to be assertive, so we want to tell what we need without being aggressive, getting in there like a bulldog and getting our stuff. We might get what we need, but then we tend to alienate people, and not in the long run, things don't work out. Sometimes repeating back is really important. So I could say back to the doctor, all right, so it sounds like what you want me to do is to give my mom one of these pills every night before she goes to bed. So that way I'm double checking and making sure I got the right message from the healthcare practitioner. We practiced before about listening, right? Well, that was hard to listen, wasn't it? You want to talk. And to be appreciative. The healthcare workers are really there for you and want to help you. And so, a little thank you goes a long way there, all right? So what I want you to do now is I want you to practice with a group. So get into groups. We can move the chairs around. The last group was really good, just got the whole room all in different configuration and everything. And get in a group, 4, 5, 6 people. And here's what we're going to talk about. Your mom has dementia, and she started on a new medication on Monday, all right? She's starting to have some side effects to that medication, and she has an appointment with her primary doctor. Well, we can say Monday, because tomorrow, hopefully, I don't know, maybe you have a great primary doctor that sees people on Sundays, but anyway, all right, they're going to see the primary doctor. So I want you to use some of the techniques that we used during this class, all right? So discuss the ways you're going to prepare for the talk, the visit. Describe what you'll say to the doctor and any techniques or strategies. All right, so I'm going to give you another 5 minutes or so. Go ahead and get in a group and just talk in that group about what you would do to get ready for that visit for your mom. And you can get up and move around. No, you don't have to. Just talk about what you would do. Okay, take another minute and wrap up. Just finish up here. Okay, let's turn around. Come on back to your seats, or you can stay where you are. Just turn your seat back around. Get wherever you are, comfortable. Right? See, you've all made new friends and all kinds of good stuff now. Okay, is there a group or two that would just like to share something? Anybody come up with something that they want to share with the group? Any thoughts that anybody had that they, oh, I see a hand back here.
For you.
One thing that we learned, or they taught, is that when you talk to the doctor is to go with as much information, even if it's the little details, to help the doctor to get a big picture of what's going on. And that's real important. Like example is I said, well, she's not eating. I think that's a side effect. Well, what does not eating mean, and why is she not eating? Maybe the medicine is a bad taste in her mouth, or maybe the food got cooked a little differently or something. But try to be as specific as possible.
Great, thank you. That's good. All right. Any other words of wisdom from the group? I heard lots of great discussion when I was out there. Any other words of wisdom from anybody, any group? Oh, I see a hand here.
Right here. Oh, here you go.
Hang on.
Don't start a new medication on the weekend.
Oh, hey, that's a good, yeah. Don't start new medications on weekends, right? that is good. And you know what? Unless it's a true emergency, don't start more than one medication at a time, okay? Because otherwise then you don't know what's causing those side effects or whatever. If I start 2 or 3 medications, then I've got to stop everything and figure it out, right? I start one medication, I wait, you can ask the person who prescribed it how long you can, should go to find out if there's side effects or not. But that's a real good way, one at a time, okay? Well, thanks everybody for sharing and stuff. That was really good. I saw heard a lot of good conversations and stuff. Now, I think one of the most important things here, though, to take away is remember that you have to take care of yourself, all right? I love that quote up there. You can't pour from an empty cup. You've got to rejuvenate yourself and keep yourself healthy. So, all those good things your mom told you, right? You got to eat right, you got to sleep, you got to do some exercise or some movement, laugh, talk with friends, join a support group. Any of those things that keep you going is so important too. And so looking at our talk today, we defined communication, we described the difference between verbal and nonverbal communication. We discussed 3 techniques to use while communicating with your care recipient's health team, and we practiced our communication skills. So I teach a class that's called Powerful Tools for Caregivers. It's a 6-week class, 1.5 hours a week, and it's on Zoom, and it helps family caregivers learn to take care of themselves while caring for somebody else. And I have a class starting in April. It's free. If anyone's interested, out at the Opeka booth, there'll be some flyers. And then my big thing is that I want people to take something away from a talk, right? A lot of times we take our papers like, oh, that was such a good talk. Oh, I loved Carol. And then we put it on the shelf and we never look at it again. So you can write on your paper or just think in your mind, what's one thing that you'll do this week, All right, maybe you're going to pay attention to your body language. Maybe you're going to look online, see if your mom or your husband, whoever you're caring for, has that healthcare portal I was talking about. And maybe you're going to say, just accept that you're doing the best that you can. All right, who has the first question?
We do have a microphone if anyone wants to ask Carol a question.
Everybody's ready for lunch, right? They're
We
all
have a question
okay,
over
back
here.
Can we get a copy of the slides?
Copy of the slides. I'm fine with that. I know we just asked Kevin too, so I think he's going to try and arrange it or whatever. Okay, so I'll say we can get out the copies of the slides so you've got those. I know it was a lot of information, wasn't it? Anything else? Oh, question?
Can you give an
Here you go.
example of, in communication space?
So the question was if you can give an example on communication space?
Oh, space, okay. Well, how close you are to another person, okay? So let's say this is a person, right? Am I like right next to them, or am I giving them some room, right? If it's a loved one, you're probably a little bit more closer to them. If it's somebody you don't know, I don't like people in my personal space, right? It's like, okay, I'll say that to people. Okay, you're in my personal space. Now we had a question. We have a few minutes, don't we? We had a question from the last time about what if your loved one doesn't agree with the visit, all right? And I asked, you mean agree with you or agree with the healthcare practitioner? So we looked at both sides. So what if your mom or your husband or whoever really does have dementia, all right, and you're taking them to the doctor and they don't agree with you? So maybe before you go to the visit, sit down and discuss what's going to be talked at the visit, all right? Sometimes that person with dementia does well if you make just a couple notes for them. Don't give them a big long list, all right? But just, Mom, we're going to talk about medications, and we're going to talk about, I can't even think of anything else. We're going to talk about, what diet you should be on, okay, what you should be eating. So maybe I make a list for Mom so that she knows ahead of time, because I know sometimes the care recipient feels like you're talking about them and they're not part of the process. So you might, just talk to the doctor. Okay, our first concern is medications, and, Mom, you've got that on your list there too, so they feel included. And then maybe they're not agreeing with what the doctor is saying, right? Well, I don't want to take that medication, or I don't need to eat anything different. So you can say something like, well, let's just listen to the doctor right now, and we'll write things down, and then we'll discuss it when we get home. Okay, so you don't have to make them, you have to force it. Well, you're going to have to take that medication, all right? So it's you're not getting them upset and stuff, especially the person with dementia when they're out in a different environment. Sometimes it's confusing for them, new places, new people, all those kinds of things. All right, well, thank you very much, everybody. I was so thrilled to be here and be part of your day.